Okay, my name is Susan Lynch and I'm a United States University nurse practitioner student, and I have a patient volunteer, Miss Jill Smith, who has volunteered to allow me to do a thorax and lung exam on her this evening. And Miss Smith, would you allow me to video record this and upload it to YouTube for viewing from my professors at United States University?
Yes.
Thank you. Okay, so to start with, for the lung and thorax exam, we're going to start with inspection, and we want to look at the chest and the chest wall, make sure there's no abnormalities, no concave chest, make sure the rib cage is symmetrical, make sure there's no accessory muscles being used, no respiratory distress, and that everything, it looks good, looks symmetrical, and the anterior and posterior will both be inspected, and there's no diaphragmatic breathing, no signs of distress, no retractions, and we have a 1:2 ratio, and the respiratory effort is normal. Once that inspection is complete, we would also look for the nails, and we would look for cyanosis in the nail beds, the lips, the mucosa. Is it still recording?
Yeah.
Okay. And for the nail beds, we're also going to look for clubbing. We're going to make sure that we have a good capillary refill that's less than 3 seconds. The fingers and toes we can assess for clubbing and capillary refill. Let's see, did I miss anything? I think that's it. Okay, and then palpation. We're going to move on to palpation, and we're going to palpate the intercostal areas, making sure that there's no tenderness, there's no intercostal tenderness. Do you have any tenderness in this areas? Okay. No. And we're basically going to palpate the ribs and intercostal areas posteriorly and anteriorly, and we would make sure there's no pain in any of these areas, basically anteriorly and posteriorly all over. And then I would move on to palpating and measuring the respiratory excursion. So if I can have you stand up, Miss Smith, I'm going to have you stand up, and I would put both hands to the back of Miss Smith. I don't know if you can see this, but I'm going to have both hands to the back of Miss Smith, basically almost at the base of the rib cage, and ask Miss Smith to take a deep breath. And you can exhale. And I'm looking for, okay, you can breathe normal. I'm looking to make sure my hands are expanding equally, and make sure that not one is asymmetrical. And I'm going to do this posteriorly and anteriorly. Okay, you can go ahead and sit back. Okay, and then I'm going to also check for, I lost my train of thought. I'm also going to check for tactile fremitus. Okay, so when I do this, I'm going to put my hand, it keeps beeping, sorry, in the intercostal space, and I'm going to have you say 99. So you can say 99.
99. 99. 99.
And I'm going to move all over the rib cage, anteriorly and posteriorly, and I should be able to feel that slightly, not really, really strong. It should be a slight feeling that I have. If I feel it strongly, then there's probably more solidity in there, and it shouldn't be. It should be more resonance. Okay, so then, let's see, I've palpated for tenderness. I'm going to percuss, and I'm going to use my finger to percuss. So I'm going to use my middle finger, and I'm going to percuss, listening for resonance and not dullness. and I would percuss anteriorly and posteriorly, and this would be to make sure that I don't have any solid areas. So I would percuss. My dominant hand. And I would do this anteriorly and posteriorly, listening for resonance, not dullness, making sure that Miss Smith does not have any solid areas in the lung area. Okay, and then let's see, the diaphragmatic excursion we did with the measuring. When you let's see, oh no, I do need to do the diaphragmatic excursion. Okay, I did the respiratory excursion. Okay, so I want you to stand up. Sorry, lost my train of thought again. If you can, if you want to go ahead and stand, yeah, I can still have you in the video. You can stand and you can take a, hold on, let's face the camera, yeah. Right. And what I would have her do is take a deep breath, and I would tap down, and then you can exhale. And what I'm going to do is find that you can breathe normal. The bottom, sorry, I need to have her breathe. I'm going to have her, when she breathes a deep breath in, I'm going to find the bottom of the diaphragm, and when she exhales, I'm going to find the bottom of the diaphragm. And the difference in those, it should be, that's the difference and gives us the diaphragmatic excursion. You can have a seat. So that's how we're going to measure it when they're taking an inspiration and expiration, and I'm percussing. Okay, and then I'm going to take my stethoscope and auscultate anteriorly and posteriorly, and I'm going to listen to all lung fields, and I would be using the diaphragm and the bell, and I would listen to all the lung fields and in a ladder pattern. Okay, so I'm gonna, whenever I put the stethoscope on you, I'm gonna ask you to take a deep breath in and out, and you can go at your own pace. I don't want you to get too much air or too winded. Okay. Can you turn that way a little bit? Yeah. So the pattern I'm using is, I'm gonna go from one side to the other, down to the other, and I'm gonna keep on going. And then I'm also gonna listen on the sides, both sides, and of course I'm using the bell and the diaphragm. And let me see the back. And I'm gonna also do the same thing with the back. So you can just take a deep breath. And you can breathe normal. I'm gonna do the same pattern, going both sides using the ladder pattern. And you don't want your patient to breathe too fast to have them hyperventilate. That would be working against you, of course. So you want them to talk to you and make sure that they are not breathing too fast in this exam. Okay, and you also want to listen to, you want to make sure you're listening to all the areas and also on each side, anteriorly and posteriorly. I think I said that. And then for my specialty test, I would do the bronchophony, and that would be listening and have my patient say 99, and I should not be able to hear clearly 99. It should be muffled. So say 99.
99, 99, 99, 99.
Okay, and that's what I heard. And that should conclude my thorax and lung exam. Thank you.